vaccine passports, and then people who are confused, just like you said, Satvir, who are told to work from home, but you can have a Christmas party, even a work Christmas party. So what are the chances we'll see the same level of compliance with the new rules as we saw with the past restrictions? Well, joining me now, Dr. Audrey Tang, a psychologist and the author of The Leader's Guide to Resilience. Dr. Tang, thanks for joining us. Given what's happened in Downing Street and in the news this week, what is the likelihood of compliance with these new rules?
The problem is that people have a great sense of fairness. And if we have followed the rules and we see others not doing it, we are going to get upset because we're questioning, why is it I have to do that and somebody else doesn't? It all comes down to really understanding emotional intelligence, which comprises of the ability to motivate, to have some self-awareness, to build relationships. And certainly at the start of the pandemic, there was an element of the motivation being there. The message was clear. We knew what we had to do. We were seeing the stats. We knew it was effective. Things were working. Not only that, but there wasn't so much cost to us because there was furlough. There were other things being put in place. And also we could see it was valuable. We were protecting ourselves. We were protecting the NHS. But we're now 2 years on and we have gone past the survival stage. We are now exhausted. And any of us who are still just about standing, when these new rules come in and then we almost get that extra kick that people who have been telling us to follow the rules haven't been following them, there is a real understanding as to why people are just not happy right now.
Yeah, they're fed up. And I think ordinary people who really don't care about Westminster bubbles will just say, I'm going to assess my own risk here.
Well, that's almost because that's what's being demonstrated, that's what's being role modelled and shown to us on television. And in so many ways, I think a lot of us have had to assess our own risk. We've had to assess it when it comes to, do I make that investment or don't I? Because I don't know how long furlough is going to continue. Do I actually move to a different place because we're now working in a hybrid environment? We have got used to managing those things for ourselves and we're quite good at it. And then when almost a blanket rule comes in, which is not necessarily all that clear, and then on the one hand, people have been saying, well, we're not moving to plan B, now we are moving to plan B.
Yeah, it's confusing, isn't it?
It's very confusing. And so now we're thinking, well, I don't even know what the rules are, so I am going to carry on assessing my own judgment. If I can't trust myself, who can I trust?
There is an argument, perhaps. My experience of local radio, phone-ins, where I normally work, shows that the older generation are a bit more risk adverse, and arguably they're the ones most at risk. So perhaps just bringing in these restrictions and, does make people a bit more fearful?
Fear is a very difficult place to lead from, and what you get with fear and oppression is often rebellion. When it comes to the older generation, yes, they may be more concerned with the variant, but at the same time, we are hearing the medical reports that the new variant isn't quite as dangerous. Now, that's not to say the reports from the NHS and the delays of ambulances and getting beds, that it's not going to overwhelm the NHS if there is a problem. But at the same time, people are wanting to see others. We've got to think of the broader holistic approach to mental well-being. We can sit there and say, well, I might become ill, but at the same time, what is this doing to my mental health if I'm not seeing my loved ones for another year?
Particularly at Christmas. I mean, Nick, these have come in just before Christmas, these restrictions. Do you think compliance is going to be an issue?
I think Audrey is absolutely right. There's that sense of fairness. And am I being treated fairly? And is it right for me to follow these various rules? And I think at the end of the day, people will make their own choices. We can't decide when the variant begins to spread. And so we have to do what's best for ourselves and, more importantly, for those around us, I think. I think the more important thing, the bigger issue for people, is that we're so used these days to this instantaneous news treadmill of hearing the whole time about what's going on. And that, I think, is something that it plays into people's fear, as Audrey says. And so I think it does make people nervous. And I think people will therefore follow things while the media is warning them to do so.
And Satvir, I mean, do people go to a Christmas party? Do they not? Do they follow the example from London? Do they not? It's very confusing.
We've locally cancelled our Christmas party, just to be absolutely clear. But I think kind of both Nick and Audrey are absolutely right. You know, people I speak to on the whole want to do the right thing. They want to follow the rules. They are really angry about this issue of fairness, but also trust. You know, why should we follow the rules if we don't trust the people that are giving those rules to follow as well? So at a time when we need public confidence and we need people to comply to in order to stop the spread of this new variant, we're in a situation where people don't trust those rules, and that's a really worrying place to be. And I'm really pleased that Nick is here and actually not trying to defend the indefensible and is asking for resignations if they're needed. What we actually need is Conservative MPs to follow suit as well.
I mean, masks are one thing, aren't they, Nick? Wear a mask, but a vaccine passport, you're not coming in unless you've got it. That is a very big stick.
It is.
Do you think that's needed?
I think it's needed. Yeah, I think in the short term, if it's needed, then that's what we have to do. You know that my other half is a doctor working in the hospital, has been treating COVID patients through all these times, and so I know that the medics in particular get really angry about the fact that there are people who seem to think that it's okay not to follow the rules, and consequently quite a lot of them get sick.
Would you want a vaccine passport, Satvir?
I've actually been to places where they do ask for a vaccine passport, and it hasn't been a big deal. I think with the vaccine passports, I think a lot of organisations, I know kind of football grounds, for example, are trying to assess what that actually means, and their biggest criticism at the moment is that they're not against trying to keep their fans safe, it's just that there's just not enough clarity around them at the moment.
And Dr. Audrey, just before we let you go, if there needs to be more restrictions, do you think there's more likely to be compliance in January rather than perhaps, around Christmas?
The interesting thing about January is, in many ways, there is less to miss out on. It's a different time, it's a new year, we'll be focusing on different goals. But at the same time, it is another month on, and that means people's tolerances are going to be wearing thin. And also, I just want to bring it to the vaccine passport and the lateral flow, because that's the other option, is to have that. That's part of the passport, is having the lateral flow test. And when it comes to vaccines and people not wanting to take them, I find it really is helpful to speak to people and actually ask them, why did you have the vaccine and why didn't you have the vaccine, or why don't you want the vaccine? Because asking somebody, why did you have the vaccine? It's not just I'm complying. You get a whole range of different answers. And sometimes people talk about vaccine acceptance in general. Sometimes people talk about healthcare being available and therefore they want to engage with it. And that gives us a much broader view than almost the black and white reports that are coming out in the media.
So engage with people is the answer there. Thank you very much, Dr. Audrey Tang, for joining us. Now, still to come.